Hello, welcome to news talk presented by the SchrDbb. In this tutorial, you're going to see fractures. Now, in fractures, you're going to use the SchrDbb algorithm, where you're going to see the disease, the differential diagnosis, the endemic disease. Then you're going to have the cause, you're going to have the complication, you're going to have the background, and then lastly, you have the prognosis. So this diagram is going to correspond to another diagram of SchrDbb, which corresponds to a mechanism. You're going to have the pathogenesis, and then you have the pathophysiology. Then outside you have the epidemiology and the risk factors. Epidemiology slash the risk factors, and then lastly we have the follow-up. Now that is the diagram. Now after having the SchrDbb algorithm, that's the plan for us to work with the topic on fractures. We're going to see the definition of fractures. So what is the definition of fracture? A fracture is defined as a discontinuity. When you have a discontinuity of a living bone, discontinuity of a living bone, that is the fracture. That's what you have to understand. A fracture is defined as a discontinuity of a living bone. That is the most important element you have to know. If it's an unliving bone, it is not a fracture. So discontinuity of a living bone, it is a fracture. Now, after having the definition of a fracture, we're going to move on to the classification of fractures. What are the classifications of fractures? Generally, you need to know that classification of fracture can be divided with respect to if you are seeing the bone or not. So you can have the first one, which is open versus closed fractures. Open versus closed fractures on the classification of fractures. So open fractures generally are defined as fractures where the bone hematoma communicates with the surrounding. So if you have a fracture where the bone hematoma communicates with the surrounding, it is an open fracture. That is an open fracture. It is not that the bone has to be visible. There are times when in open fracture you cannot clearly see the bone. Is it clear? But you see the bony hematoma, which is the bony hematoma is a greasy like or fatty like dark liquid that comes out from the wound side. Is it clear? So it comes out from the injury side. So when you have a greasy or fatty and dark fluid which is coming out from that area, it is the bony hematoma. It means that the bony hematoma communicates with the environment. So that is for open fracture. The next, we're going to have closed fracture. Definition of closed fracture is one where the bone hematoma do not communicate with the environment, or simply that you cannot see the bone. In open fracture, simple definition that you can see the bone through the wound side, or the complex definition, and that's the best definition is you are capable, the bone hematoma communicates with the surrounding. But in a closed fracture, you are not seeing the bone and the bone hematoma does not communicate with the surrounding, so no communication. That is for the first classification, open versus closed fractures. Now we are going to speak about the next classification of fractures, which is going to be pediatrics versus adult fractures. You have pediatrics versus adult fractures, another classification. Now pediatrics fracture is clear. So pediatric fractures, you need to know that in cases of pediatric fracture is anything that involves a fracture of a bone that has not completely closed a fascial plate. Is it clear? A bone that is a pediatric, it is called a pediatric immature bone. A pediatric immature bone does not always depend on the age of the child. It depends on the age, but it does not usually depend on the age. So it's preferred to be able to say that in a pediatric fracture is one that is occurring in a pediatric immature bone. And a pediatric immature bone is one that the fascial plates are not yet closed, while adult bone is one that the fascial plates are already closed. That's an adult type of bone. Is it clear? So generally, pediatric bones occur when you have less than 21 years. So in less than 21 years, generally the fascial plates are not yet closed. But more than 21 years, it's already guessed that the fascial plates are closed. But now there are certain people that they can even grow up to 23, 24 years. Their fascial plate is not yet closed. So they are still considered as a pediatric immature bone and inside a classification of pediatric fractures. Basically, those are the different elements that you have to know. Now the next element that you're going to see the specific characteristics under the different classifications.